Welcome to eHealthTALK, a podcast from Health Informatics New Zealand and hosted by me, news editor at HiNZ, Rebecca Macbeth. This podcast provides insight and discussion on key topics of interest from across New Zealand's data and digital health sector. Please be sure to like and subscribe wherever you get your podcasts. Kia ora koutou, welcome to eHealthTALK NZ. Today we're diving into a new report from HiNZ which highlights concerns about digital health funding cuts and their potential consequences for patient care. To help us understand the report and its findings, I'm joined by HiNZ Acting CEO Scott Arrol and Director of Engagement Alex Kemp. So welcome on the show to both of you. Scott, can you start by giving some context to this new report? Why was it conducted by HiNZ?
Thanks, Rebecca, and kia ora, everybody. Kia ora to the listeners. Context is always important, isn't it? And firstly, just got to encourage people to get the report, read through it. It's not extensive in terms of the way it's been put together. It's summarised really well. But contextually, there's concerns clearly about the proposed funding cuts and cuts to the workforce, headcount effectively, quite significant if those proposals were to go ahead, and within context of consultations that have been going on for quite some time. So, we will see the results of those in due course. But really it comes down to the concern about just where does this leave digital in the health discussion and the delivery of healthcare. And from a HiNZ perspective, we pride ourselves on being the trusted meeting place for any type of conversation with regards to digital and healthcare and disabilities and so on, mental health, anything like that. So we were careful about how we put this report together. It is a reflection of what people, experts, clinicians and others have said back to us. So we put some questions to them and the report reflects those back. And so, obviously there's concerns, if the financial amounts that are proposed to be cut, it would push our actual percentage of spend quite significantly down, around 2.2% of the overall operating spend in health in New Zealand, and public health. That drops way below the world benchmark. And then not only workforce, whereas 1.4% of the workforce is really falling way behind. If we really want, and I know we do, as a country and as a government and ourselves, we want digital to be a key enabler to driving and helping to deliver quality healthcare for all New Zealanders.
Thank you, Scott. I'm sure everybody listening knows the details, but the consultation is going on at Health New Zealand. It's part of a wider range of budget cuts. And so the proposal is $100 million a year budget cut to what's now called digital services, which was called data and digital, and reducing the FTE count by 47%, so nearly half. Consultation is ongoing, so it's good that you've noted that, but obviously concerns that we also had budget recall in 2024 for a lot of digital projects, including the HERA project. So in that context, it was great to ask people how they're feeling. Alex, who did participate in the survey? Were the responses mainly from healthcare professionals or IT specialists or a mix or both?
We are really grateful to those who took their time to complete the survey, and we had 358 respondents from a wide range of backgrounds. So people who are industry experts, healthcare professionals, IT experts, developers, clinicians. Over a quarter of the respondents currently involved in direct patient care, whether that be someone who's considered a clinician like a physiotherapist or a healthcare assistant. And a lot more of our respondents have had a background in direct patient care. They may have previously been in a role as a clinician and now in health leadership. So we had a really wide range from both different parts of the sector, but also different parts of healthcare provisions, such as support services, hospital-based services, community, primary care, aged care.
And so moving back to you now, Scott, the findings indicate obviously significant concerns. We've talked about that, about the impact of these cuts, but give us some of the key insights that were discovered.
Yeah, sure. Well, actually, I'm going to take an opportunity just to repeat a quote that came from a survey participant. So the quote was, data and digital services affect care provision across the spectrum because there is an element of digital health in every healthcare interaction, from referral, booking, reminders, care, documentation, and management of service delivery. If progress is not being made, then we are just stagnating. But even worse, we're falling behind in how health services are being provided in Aotearoa, New Zealand. And I think that sums up a lot of what people are feeling and thinking. And so then when we look at the human cost of budget cuts and what could be described as sort of a deprioritization of digital in the health system. And whilst that might sound quite a sort of radical thing to say, that's how people are feeling. So that's a perception of what's happening. Concerns sit around the system failures and that can cause delay in care and create a risk of patient harm. That's an obvious one. We get into the administrative burdens that then flows through to less time for patient care. So 95% of respondents outlined how slow and efficient the IT systems are, and they lead to frontline staff spending more time on administration and less time with patients. We all have that frustration, don't we, with our own computers? Are they, you're waiting for them to turn on, something happens and they turn off or whatever, and then not only that, you're just trying to get your software and your systems to work together and flow. So we all experience that in one way or another in our daily lives. You imagine what it's like in healthcare, and when people who want to provide quality healthcare are spending more time than they should in front of computer monitors or screens. Clearly, every minute spent wrestling with that is a minute not spent on providing care, and that becomes demoralizing. And added to that is what has been described as the fragmented care that wastes time and creates risk. So the fragmentation across the IT service of digital services, which is not new, it's been going on for a long time. But then it's about, well, how does this get improved across the country? Learn from the things that are working well. So I think we talk about interoperability. Obviously, that conversation comes up all the time when we talk about reducing fragmentation. And then, the whole flow of data and having data at hand when most needed, for patient care. Then, the complicated systems, outdated, people are burning out. And that's really come through strongly in the survey, that there's just so much frustration, but it's borne about because people, particularly obviously clinicians, but everybody is involved in the delivery of care in this health system, whether you're an administrator right through, and there's just burnout and frustration. So that's what also came through in the survey. And what happens? People are not operating as well as they know that they could, the productivity, all those sort of areas through their burnout phase. And then people are leaving. And we know that the churn rate is high as well. So it's, that we all know the effect it has on any organization. People want to get on, do the job that they've been employed to do. They care about caring. They care about providing the best possible health and disability services that they can. And then it's the disillusionment that comes about from, well, that we don't have systems that are really supporting us to achieve that.
Some real concerns there. And obviously, you've got a clinical background, Alex. Can you just talk more about how the cuts could affect patient care and elaborate on some of the specific risks or challenges that were highlighted in the survey?
Absolutely. And I just have to say, I have experienced one too many times that spinning wheel myself, sitting in a seat trying to access clinical notes for a patient. And one of the really key things that came through first off, when we're thinking about, this isn't just about the workforce, it's really about the community that we serve as a health workforce, the people at the end of it. And we asked a question around how does the proposed cut impact those people in ways that they may not think of. And the first really clear theme that came through was a delay in patient care. You have clinicians who, if they're having to spend time waiting for systems to boot back up, if they don't have access to information and they have to write off to someone else to find out if a test's been done or to find out about the care that was provided previously, or if they're not sure that a particular test has been done and they end up repeating that, all of these things both take away from clinician time, which means that those clinicians have less time left to see patients, so their wait lists increase. but also can delay that care for the patient as they wait for the clinician to get the information they need, or they get sent for tests that may be unnecessary because another test somewhere else in the system that the clinician doesn't have information for has already been done and rules it out. I think one of the other main concerns that came out from the survey really strongly was around patient safety. We know that we don't have a fully developed national way of sharing patient information at the moment, that a clinician doesn't have access necessarily even to appointments that happen down the street from them. And so, therefore, when it comes to providing care, if you don't have all the information, you can't necessarily make the best, most efficient, safest choice for your patient. So we know that through data sharing, through access to multiple pieces of information, we can make the safest, most effective decision on the care for that patient. People also raised a lot of concerns around the possibility of care being worsened for people who are already experiencing inequity. So we have people in rural communities who currently have to travel a long way to get care or may not have care closer to them, and the ability to therefore develop technology that may help them have care closer to home. The ability for disabled people to have care that is individualised for them, and same for Māori and Pacifica populations. We also have a real concern that came through in the survey around the ability to not just work with current systems, but develop new ones. We know that there are all sorts of incredible initiatives happening in the field of digital health that could provide faster, more effective care. But if we don't have the time to provide core services and we don't have the support from the IT team to develop and trial new opportunities, how can we develop good quality new ways of treating people that will provide better health outcomes for them?
And as Scott said, these are people who care about caring. So the burnout is not just the waiting for the wheel to turn, but it's just the feeling that they aren't able to provide that care. A lot of this is not even currently a digital system. People are still working on paper. So it's physical and mental time put into just trying to get the information you need to make the right decision at the right time for that patient. So the frustration, I think, is palpable. And that burnout piece, I think, is particularly important. And we highlighted it in the report about, just adding to a general feeling of burnout. But also, I think it came through strongly how much people do value the systems that they've got. Digital perhaps hasn't always been in the limelight. People haven't always appreciated it, but I think everybody now understands the role of technology and the importance of it. And if they don't have the systems that they need, I think that is a big factor in how they feel about their work and whether they want to continue in the workforce. And that came through as well, didn't it,
Oh,
Alex?
look, there's a saying amongst clinicians, none of us are in it for the pay or the glory. You really do have to care about people and the outcomes for them day to day to stay in a healthcare role, in a frontline role in particular. And as one of our respondents said, I cannot hand on heart tell the person standing in front of me that I'm providing them with a quality service at the moment. That really disseminates job satisfaction for people. And so we had a large number of respondents saying that they do think that this will lead. In fact, many of them mentioned colleagues who were talking about going overseas and going to different healthcare services. It's also really frustrating when you're aware that there are better ways of providing care out there, but you can't do them. That you know that there are technologies, there are efficiencies available that could really make a big difference to the outcomes you can achieve with the people that you're trying to help, and you just are stuck and unable to provide that care. And that will lead to people seeking jobs outside of the public service in particular. And that was a very strong theme in the individualized responses coming through from people.
Yeah, and when that knowledge walks out the door, and there's no guarantee that you can get it back if you suddenly decide you want to reinvest in that area. So we've talked about what the frustrations and the concerns are, but we really wanted with this survey to put a bit of a positive spin on it and talk about the opportunities. So we did give respondents the opportunity to put forward their ideas about where those greatest opportunities are for digital investment to improve care, to gain efficiencies. So I'm keen to hear from both of you what came out of that. Perhaps, Alex, you could start with the first few and then Scott could pick that up.
We asked people directly in the survey what they saw as the top opportunities to really make a huge difference to patient care in the area of digital health. And there were 5 themes that came through really strongly. The first one I would like to talk to is around national health shared records. We've talked about the problems already in this podcast that come from that, the inability to provide safe, effective, timely care, the wasted time for clinicians trying to get that information via telephone, via having to walk around the hospital, or just simply not having that information, especially in a time of crisis, what that can do. Um, and if we manage to expand on what's already there or implement another way for all healthcare workers to be able to access timely current information on the person in front of them, it would make a huge difference in our ability to provide care that is safe, effective, and really centered on the person in front of us. The second initiative that I want to speak to is around AI-driven diagnostics, and this is an area which is just growing at such a rate. The ability to detect breast cancer that would otherwise be missed, the ability to detect cancer cells. There was a recent announcement about the regional screening program in Mangere, which is a pre-diabetes screening, which is based on AI. We know that AI technology is a support system for clinicians, is a absolute wonderful opportunity to get things done quicker, faster, more effectively and safer. And that came through as probably the major theme following shared patient records and the respondents in the survey.
Coming back to the area of telehealth, and in particular, patient anywhere, clinician elsewhere, or PACE, which is a really good acronym. That's an area that offers huge, let's say, efficiencies, but connectivity with patients anywhere. So if we've got someone in the far north of the North Island requiring a degree of healthcare that can be done via a telehealth connection, that clinician could be an Invercargill. And actually, the benefits of that sort of thing is around right clinician providing right care, at the right time, and all of that side of things. The patient at the other end, getting some more immediate consultation as well, and that doesn't stop in terms of our borders, our coastline. So the clinician could be in Australia, and in fact, that's happening now. There's actually clinicians in New Zealand that are providing care virtually to some more advanced healthcare systems and telehealth systems, like, for example, Western Australia. And while we're talking acronyms, RPM. And what's now being developed is remote patient monitoring, and link that to PACE, RPM at PACE. You'll start to hear that come through more and more. So being able to monitor a patient remotely at that point in time doesn't require a clinician, but there's a clinician available when the clinician is needed. And that's a really smart, clever way to use our resources and the right people at the right time. The other side of that too is, of course, telehealth is not panacea for all health ills. It's actually another enabler that has huge opportunities, but there's a lot more that can be done and must be done.
And Scott, just listening to you talk, I can tell a story of when I lived in Whakatane with my children, and one of my children was under Starship, and it was a flight. It was a flight to see the team at Starship, and how much easier it would have been if we had had some ability to have some of that care a little bit closer to home. I'll just add too, in terms of the monitoring, it allows people to go home sooner after care as well. So if you have patient monitoring, as we're talking about, where you can monitor with smartwatches, with all sorts of wonderful technology, heart rate, oxygen levels from a computer hundreds of kilometres away, it allows people to be closer to home. And we know that that can really improve the outcomes for people. We know that people walk more when they're at their home. We know that they talk more when they're around people that they're comfortable with. We know the risk of falling post-surgery is a lot less. So if we can get people home in their safe environment, but still being monitored carefully through remote patient monitoring, that makes such a huge difference.
People aren't waiting for this to happen either. There's allied health professionals who are doing virtual consults and saying in speech language therapy, particularly in disabilities, areas like people with motor neuron disease, which is an area that I understand pretty well. And of course, they lose the ability to speak and also breathe and swallow, all of those things. Those consultations are occurring in the country at the moment virtually through very clever speech language therapists who are driving that. Areas such as, if you talk to New Zealand Plunket, where, and this is definitely an area outside my expertise, but around training new mothers and their babies to breastfeed. And it is a big issue, which Plunket used to solve by sending people into people's homes. And all of that resource that takes, they discovered that actually for most new mums, that could be done through a virtual consultation. And they went through a change process. And across the country now, the most common way for a new mum to have help and assistance with breastfeeding with a new baby is initially, it's usually solved through 1 or 2, 3 virtual consults. So you know what Kiwis are like? We're not hanging around. Stuff's happening. And that's an important thing to know.
One of the other recommendations in terms of initiatives that can be trialled is around smarter patient flow. Now, what this means is the ability to track people in hospital to allow things to work more smoothly. And if we think about an ED department where it's very busy and there's lots of hustle and bustles, having digital tools to help track when people have moved out of beds and when things move around can help people make that process more efficient. An ED department is very busy, it's very bustling, people can change very quickly, and it's very difficult when you've got multiple beds to keep a physical eye on everything. So we know tracking and monitoring there and across beds in the whole hospital, often an ED bed isn't available because you're waiting for a bed in the hospital because you're waiting for someone to be discharged and you've got to wait for that call to come through. If you've got real-time tracking, you can speed up that process a lot for people. And that means that there's less delays for everyone in the system. It also helps track things like bed use. Where are we not using beds as much? Where are we overusing beds? Could we perhaps use wards slightly differently, etc.? And that ability for people to move through the hospital where, again, care is the most expensive. If we're thinking about where we put our precious health dollar, care is the most expensive. And when you need to be in hospital, we want you in hospital. We don't want to kick you out earlier, but where we can make things easier in that care to be more efficient and faster, we want that to happen. Digital solutions can be a real game changer in that space when you're trying to look at a complex system over multiple wards and multiple different types of activities. And the last one I want to talk about is predictive analytics. And what predictive analytics is, in short, is the ability through taking data from multiple sources to predict what might happen with a particular population in a particular area so that you can start to make some good decisions and also start to make some preventative decisions, which mean people don't necessarily need to end up with in a state where they need complex health care. So examples of that might be finding out that a particular area of Auckland has a higher rate of diabetes. Why is that? Or finding out that a population, that a group of children in one area might have more respiratory disease, which might be related to the housing in that area. And when you start to get that information from multiple sources, from housing information, from the hospital, from the population as a whole, you can really start to make a difference to multiple people at once. And so that helps people because they can prevent problems. Again, we go back to this wonderful diabetes screening in Mangere, which was announced recently. But it also can be a huge cost saver if we stop people from what we call the ambulance at the bottom of the cliff, from getting so sick that they actually need the costly, expensive care when we know that so many health conditions are preventable. So to go over that again, we've got national shared healthcare records, which allow people to have the information that they need to provide the best care for that person in front of them. We have AI-driven diagnostics, just quicker, faster, more accurate, more detailed decision making to help guide care. We've got patient anywhere, clinician elsewhere, so being able to provide quality care at a distance. We've got smarter patient flow, which is about helping people move through that most expensive part of the hospital in the safest, quickest way possible and making the most of those expensive resources. And then we have predictive analytics, which really helps us understand larger groups of people and how to prevent those and avoid health problems where we can.
Thank you. It's a really good summary there. So, Scott, what has HiNZ done with the report?
It's the old saying, isn't it? That, you often write a book or a report and then it goes on a shelf and gathers dust. But we're not letting that happen to this one. And because we've got responsibility to the people who not only took time to respond to the survey, but the broadest sense of everybody that's in healthcare, be they patients or staff, clinicians. And so, we've developed a briefing for the incoming minister. So it was kind of like very sad to see Minister Riti go, but then also we welcomed Minister Brown into the hot seat and took that opportunity with having the survey to then also prepare a BIM, or briefing for the incoming minister, as they call it. And what we really emphasise, and it did come through in the survey, whilst there's concern, there's angst, there's worry, and just what Alex has gone over, they also took the opportunity to say, well, hey, there are some things that can be done. We linked it to the health targets and the government's priorities. We said, hey, there is concern, but also the same people are telling us there's ways of doing this that is smarter, that is better. So we've really reflected that into the BIM as well. And also, like, digital in itself is not the end game. So, it's part of the enabler. It's a key enabler to the delivery of high quality healthcare for all New Zealanders. Sometimes the conversation leads to, well, it's all about digital. Well, actually, it's not. Digital is a key enabler, and we must look at that. And often in the past, as we've talked about this, we'll know that we've achieved what we want to achieve when the word digital is not used anymore. It's just health. It's healthcare or disability services. It just so happens, just like a clinician, just like workforce or anything like that, or bandages or anesthetics, digital is part of it. That's what you do, And so we're trying to get that across to the minister and to the government. We'll always represent our stakeholders in that regard within a trusted space. So we just want engagement, and that's our request to him and his officials and the rest of the government. And we're not turning up and pounding on the table over one sort of interest group. We've got a range of stakeholders, and we undertake to represent those views, but always look towards what's best for the country, what's best for New Zealanders.
And I know, Alex, you've also sent it to a lot of clinical leads and started sending it out to some of the key organisations that represent other areas of the health sector, primary care, aged residential care. What do you think are the themes or findings that will most resonate with clinicians and decision makers across the health sector?
Look, I think there are two main themes that come through from this. And one is that we cannot say that the loss of what people talk about as non-clinical or non-frontline staff or non-clinical or non-frontline services, we cannot think that has no impact on frontline services and on our communities that need those health services. There is a direct impact that comes through when you lose that. We know that the future is becoming that every clinician is going to have to be a digital health clinician. I've been saying that a bit lately, and I seem to get a lot of, oh, what was that you said when I say that? So it's resonating with people. The world is changing. We are becoming so reliant on technology. We know from what's happening overseas that this is the future of health. This is the way health is going, and every single person is going to need to understand how to use digital technologies. And we cannot do that without the incredible people who develop those products, who keep them working efficiently, but also work with us so that we can develop the right tools to provide the right services to the community, that it's such an integration of roles that you cannot separate out one part above the other as being more important when it comes to providing a good digital health solution. And I think the other thing that will really resonate with people, especially those who hold a budget, is this isn't asking for more. As Scott said, this is about internationally proven cost savings initiatives that do take some money to implement. And we've talked a lot in this report about focusing on health initiatives rather than finding money from a budget that isn't there. All of these digital transformation tools have got proven cost savings initiatives, and we've referred to those in the report. Up to 20% reduction in length of hospital stays using predictive analytics, 5 to 10% savings in overall healthcare spend using AI-driven diagnostics. Those are big numbers we're talking about. And I think those in leadership positions, having held a rather large budget in one of my previous jobs, as well as being a professional leader, they want to understand the value add in terms of cost benefit. And this report, I hope, will start to show where some of those initiatives are both great for people, great for the clinicians, but also a cost savings initiative for a system that is really needing to find cost savings.
Thank you, Alex. And this is also going to, via our media channels, continue these discussions around those 5 opportunities. So they'll be flowing through into our events at AI Summit in May, but also through our media. So there will be further podcasts, news stories, and other channels where you can learn more about those 5 key areas, what's happening in that space, what the opportunities are. So really blowing that through all the way through to Digital Health Week at the end of the year in November, which this year is going to be in Christchurch. So that's all we've got time for today. Thanks for joining me, Alex and Scott. If you would like to read the full report, you can find it on the HiNZ website, and we'll also put it in the show notes. If you enjoyed this episode, don't forget to subscribe and share. Stay tuned for our next episode, where we will continue to explore those opportunities to advance healthcare using digital solutions. Mā te wā. Thanks for listening to eHealthTALK. Be sure to subscribe and share with your colleagues and friends. eHealthTALK, eHealth News and the eHealth webinar series are supported by Health Informatics New Zealand. See hinz.org.nz for more information and become a member starting at just $17 a month. We also have affordable organisational membership options for both our industry partners and healthcare providers.